A hearty welcome to one and all present over here. I, Dr. Kumar, and today I'm going to deal with the topic of disorders of newborns. Introduction. Most mothers observe their babies very carefully and are often worried about minor physical peculiarities which may be of no consequences. The first thing that today we'll be dealing is vomiting. As you all know, what is vomiting? So, vomit on first day due to irritation of stomach by swallowed amniotic fluid. If the child has swallowed amniotic fluid, there are chances that he may vomit. Second point, vomiting soon after feed is due to faulty techniques of feeding. There may be various problems which may lead to vomiting, in which the faulty technique of feeding, either the baby is not placed in a proper position, either proper burping is not being given, then also vomiting may occur. Third, the proper advice regarding feeding and burping must be imparted to all mothers. As I discussed previously also, newborn babies with new mothers or the primary mothers, they have to be taught regarding the proper feeding techniques and burping, as it is a very important factor which may lead to vomiting. If vomiting persists for long, it leads to some other conditions. If the vomiting just occurs and then the baby is feeding normally, then there are no issues. But if the vomiting continues for a longer time, then there may be some other conditions. Second point that we are going to deal today is failure to pass meconium and urine. Healthy babies must void within 24 hours of age. It is very important. The babies pass black stools during first 2 to 3 days of life, followed by greenish stool for next 1 to 2 days. The non-passage of meconium should be informed to the physician or other healthcare professionals. Constipation. Babies on cow milk formula are often constipated due to hard casein curds. Constipation is best managed by giving frequent breastfeedings. The laxatives should be avoided. If the baby is having constipation, he or she should not be given any sort of laxatives. Next point is diarrhea. The breastfeed babies develop increases frequency of stool if the mother is taking ampicillin, cephalosporins, tetracyclines, certain laxatives, and following excessive consumption of food with high organic acid content such as oranges, cherries, tomatoes, and chilies. The intake of large quantities of glucose water and honey by the baby may also result in diarrhea. Diarrhea may also occur due to overfeeding or serious feeding issues like underfeeding. Then comes physiological jaundice. Physiological jaundice appears on the second day of birth, reaches peak on the fourth or fifth day, and disappears by 8 to 10 days. The best management for physiological jaundice is exposing the baby to sunlight for about 10 to 20 minutes. If necessary, phototherapy can also be given. So if a baby is properly exposed to the sunlight, there are chances that his physiological jaundice may be recovered. While exposing the baby to sunlight, some of the very important things that we have to keep in mind that baby's eyes and perineal area should be covered. The next point is hiccups and sneezing. Hiccups are produced by spasmodic contraction of diaphragm and characterized by sudden, noisy and jerky retractions of suprasternal notch and xiphisternal region. It occurs usually immediately after a feed due to distension of stomach and irritation of diaphragm. Sneezing occurs due to irritation of the nostrils by secretion. It should be stuck out by mucus sucker or using catheter. Fever. During summer months, when environment temperature goes about 39 degrees centigrade, some healthy newborn babies may develop fever on the second or third day of life. The baby should be dressed with light and loose cotton clothes, and the environment should be kept close in summer. In summer also, the environment should be kept close, and I have seen in many of the conditions that the baby is kept warm by wearing excessive amount of sweaters and blankets and all. Okay, if the temperature is cool, then it is okay, but if the temperature is not that cool, avoid wearing so much clothes on the baby. Excessive crying. The babies usually cry. As we all know, the babies cry a lot. The babies usually cry when they are hungry or discomfort. This may be due to some unpleasant sensation of full bladder before passing the urine, painful evacuation of hard stool, or mere soiling of urine and stool. The insect bite should be kept in mind is an important cause of night crying. If the baby is crying excessively, we should look after to all these points. Oral thrush. The infection most commonly occur during the passage of the baby through infected birth canal, infected feeding bottles. Because of that, it is advised that the baby should be kept in exclusive breastfeeding up till 6 months. Contaminated breast nipples. The breast nipples should be cleaned before and after feeding, and prolonged antibiotic therapy may result in candidiasis. The oral lesions are characterized by discrete white patches or spots over the buccal mucosa and gums. The baby may be able to suck normally, but swallowing may be difficult due to posterior oropharyngeal white patches. Oral application of 0.5% solution of gelatin violet after each feed gives prompt response in most of the cases. In this picture, you can see that the baby is having oral thrush. So you can just imagine how painful for the baby it may be. Next comes excessive sleepiness. Some babies may keep their eyes closed most of the time during the first 48 hours. During the first few days, many infants go to sleep after taking only few sucks of bottle or breast. The baby should be kept aroused during feed by tickling on the soles and behind the ears. Heavy maternal sedation during labor may be associated with excessive sleepiness in the baby for the first 48 hours. Mastitis neonatum. The enlargement of breast occurs in full-term babies of both the sexes on third or fourth day and may last for few days or even weeks. Lack of inactivation of progesterone and estrogen after birth due to immaturity of neonatal liver leads to further rise in their levels, thus resulting in hypertrophy of breast. So for that, the local massage fomentation should be curbed and mothers should be reassured. Here you can see a baby which is suffering from mastitis. Next comes vaginal bleeding. The development of menstrual like withdrawal bleeding may occur in about 1/4 of female babies after 3 to 5 days of birth. The bleeding is mild and lasts for 2 to 4 days. The local aseptic cleaning of genitals is advised in these cases. Caput succedatum. It is a boggy, diffuse, edematous swelling of soft tissues of scalp over the presenting part. The swelling is present at birth and its size and severity is related to the duration of labor. The swelling is pitting, it's non-fluctuant and not limited by sutures, unlike cephalohematoma. It disappears spontaneously after over a few days. Here you can see a baby with cephalohematoma. So this is caput succedatum. Here you can see the baby with caput succedatum. It will disappear after some days. Next that we are going to deal is cephalohematoma. It is subperitoneal collection of blood secondary to injury during delivery. The swelling appears after 2 to 3 days of birth. It is a fluctuant swelling and does not cross the suture line. It resolves spontaneously after a few days or weeks. Incision or aspiration is contraindicated unless it gets infected. So if you get infected, then only we should go for incision or aspiration. Otherwise, it will resolve on its own. Here you can see the baby who is suffering from cephalohematoma. Next that we are going to deal is asymmetric head shape. Occiput or one of the parietal areas may become flat and bald. The head size is normal. There is no cause for concern. So for that, proper positioning of head with support of soft pillows is to ensure that the prominent part of the head touches the cord, leads to the gradual rounding of the head shape. Next that we are going to deal is craniotapes. Softening of skull bone, which may be pressed like a table tennis ball, is called craniotapes. For that, localized craniotapes may be normally seen due to in utero pressure of the skull against mother's pubic bone. Sore buttocks and napkin rashes. Use of nylon or watertight plastic napkins and delay in changing the napkins causes redness, induration, and excoriation due to ammonical dermatitis. So the bottom should be cleaned gently with wet cotton and kept dry and exposed to air. Application of soothing ointment or coconut oil provides relief to the child. Here you can see a baby with rashes. Next topic till today is erythema toxism. It is erythematous rashes with central pallor that is wheel-like appearing on the second or third day in term babies. The rash starts on the face and spreads to the trunk and extremities in about 24 hours. It disappears spontaneously after 2 to 3 days without any specific treatment. Here you can see the thing. This is what erythema toxism. Clear? The erythema toxism, it occurs to the child. It looks like this on the child's tummy. Next we are going to deal with hurricane color change. First I'll show you the picture. This is the picture in which it is shown that the baby is having hurricane color change. You can clearly, it's clearly visible in the picture that there is a color change in the body, baby's body. So what is this? The baby suddenly becomes blanched and pale on one half of body while the other half remains pink. The episodes of color change last for few minutes and occur in normal babies due to unexplained vasomotor phenomena. Stroke bites, that is salmon patches or nervous simplex. First we'll see the pic, how it is look, how does it look. So here we can see the child who is suffering from this condition. So what is this? These are discrete pinkish gray sparse capillary hemangioma commonly located at nape of the neck, upper eyelids, forehead and root of the nose. They invariably disappear after a few months. Next that we are going to deal is subconjunctival hemorrhage. Here you can see in the pic the baby who is suffering from subconjunctival hemorrhage. Semilunar arcs of subconjunctival hemorrhage located at the outer canthus is a common finding in normal babies. The blood gets reabsorbed over a few days without leaving any pigmentation. So here what happens is that the blood gets reabsorbed after a few days and it will vanish off. Next is subcutaneous fat necrosis. Here in this pic you can see the baby who is suffering from subcutaneous fat necrosis. So what is this? During early newborn period, some babies develop subcutaneous fat necrosis as localized area of induration without any inflammatory sign over the buttocks, back, cheeks or limbs. There is no clinical significance and the condition resolves spontaneously. Tongue tie. This is a condition of tongue tie. It may be either in the form of thin broad membrane or thick fibrous frenulum under the tongue with a notch at the tip of the tongue due to traction. Tongue tie interferes with sucking or delay the development of speech. The genuine tongue tie may be snipped after 3 months if it is a source of anxiety to the parents. Acne neonatal. In this pic, you can see the baby who is suffering from acne neonatal. Typical acne lesions may be seen over the forehead, nose, and cheeks at birth in term babies. They occur due to transplacental passage of maternal androgens to the fetus. The skin lesions gradually diminish in size and disappear spontaneously within the next few days. Congenital teeth. Here you can see the baby is having congenital teeth. The eruption of one or more lower incisor teeth before or soon after birth is seen 1 in 4,000 babies. The teeth may become loose and interfere with breastfeeding. There is a risk of spontaneous dislodgement with aspiration. It is advised to get the natal teeth extracted. It's very important because the baby can't speak. If the baby takes in the feed, because of that, in that feed also there are chances that the teeth gets dislodged with the aspiration. Congenital hydrocele. This is a pic of congenital hydrocele. A small sac containing fluid may be noticed in one of the scrotal sac at birth or during first week of life. It disappears spontaneously during the first 3 months of life. Bowed legs. This is bowed leg. Now let's deal what is bowed legs. In normal babies, when legs are extended, they form a concavity inwards due to genivirus, giving an appearance of bowed legs. It is not suggestive of rickets or bony deformity. After first birthday, bowing of the legs is replaced by physiological knock knees. Umbilical hernia. Here the child shows umbilical hernia. When the cord has fallen off, umbilical hernia may manifest after the age of 2 weeks or later. It may be associated with diversification of recti. Most of these disappear spontaneously by 6 months to 1 year. Application of coin and bandage over the hernia is not recommended as it was practiced before, but it is not recommended now because it may further weaken the anterior abdominal wall of the child. If there are any associated conditions like increased intra-abdominal pressure like excessive crying, constipation, persistent cough, etc., to be identified and managed appropriately. I hope today's session is clear to all. Today we have dealt with the minor disorders in newborn. Thank you all.